A bit about Dr. Alex Wodak. He was the Director of the Alcohol and Drugs Service at St Vincent's Hospital, Sydney from 1982 to 2012, and is now an emeritus consultant there. He's been President of the Australian Drug Law Foundation for many years. Dr. Wodak and his colleagues helped to establish Australia's first needles syringe program in 1986 and Australia's first medically supervised injection centre in 1999, when both were pre-legal. He is now working with some legal academics on a discussion paper on the regulation of recreational cannabis. So will you please welcome Dr. Alex Wodak, President of the Australian Drug Law Foundation.
Thank you very much, John. Thank you very much to the Queensland Council of Civil Liberties for arranging for tonight, and thank you all for coming along. And thank you, Lindsay, for coming along and reminding us why we do this stuff. Very important that you're here, and thank you, Lene. Listening to you, I'm reminded of the fact that in the 1920, alcohol introduced prohibition. The United States introduced prohibition of alcohol, and not many people realised that it was really the women's movement that was responsible for bringing alcohol prohibition into the United States, and that it's connected with the suffragette movement. And of course, the results of that were very negative, very disappointing. And it was the women's movement that was responsible for throwing out alcohol prohibition in 1933, 13 years after it was introduced. So people often talk about women as being not really having much influence in our community. Don't you believe it, Lene? I hope you keep on with your advocacy. You do have an effect, you really do. And I hope you and other families that are linked to this issue of medicinal cannabis band together. The more you fight together, the faster it will be before we get what we really want. Now, this is the best year we've had for drug law reform in Australia ever. We've really, the dial has shifted in 2017. Certainly in terms of thinking, and we're starting to see some changes in government policy as a result, and I think we'll see even more in 2018 and thereafter. Why has this taken place? Well, I think it really began, things really started changing around the world in 2011 when the Global Commission on Drug Policy got together and held a press conference in New York in June. And there were about 20 or 30 former presidents, former prime ministers, some current leaders of their country, and there were a few former UN Secretary Generals. And now that movement has grown. The number of those people, there are now about 40 people in that group, and they are becoming more and more active. They're certainly having an effect. Why did they get together and argue that we need to change our drug policies? I put it to you, it's really for three different sets of reasons. The first reason is that the drug market in Australia and around the world has got bigger and bigger during the time we've been pursuing drug prohibition, and it's got more and more dangerous. Now, it's very hard to make a statement like that because the figures on drug consumption and use and production are very woolly. They're not very exact. They're guesstimates. It's illegal, so how can you try and measure it? But nevertheless, all the data that we've got points in the direction that I just said, that the market's bigger than it ever was, and the market is more dangerous than it ever was. And I'm talking here about production, consumption. The price has gone down, not up, so the price of heroin and cocaine in the last quarter century has decreased by about 80%. Purity of street drugs under Prohibition is meant to go down, and it's often risen. Drugs are readily available in Australia. We do a survey in Australia commissioned by the Commonwealth Department of Health every year, and they quite rightly survey people who use drugs. No point in surveying people who don't use drugs, so they survey people who use a lot of drugs, and they have no trouble getting hold of whatever it is they want to get hold of. The hardest drug for them to get hold of is cocaine. Only 60% say getting hold of cocaine is easy or very easy. And the figures for heroin and methamphetamine and cannabis are all in the 80s or 90s, saying that it's easy or very easy to get those drugs. So the market has expanded and become more dangerous. These days we worry about drugs like fentanyl, lacing the street drugs. Big problem in the United States and Canada and North America, a growing problem, still small in Australia. And now, as if that's not bad enough, we're seeing carfentanil, which is even more dangerous than fentanyl, is now starting to creep into the North American market. And in the United States in 2016, they had 64,000 deaths from heroin and opium-based prescription drugs. That's a hell of a lot of people who are dying, and President Trump is about to declare a national emergency, rightly so, over this issue. Probably won't do the things that he needs to do, expand treatment, have medically supervised injecting centres. We won't do those sorts of things, but at least they will acknowledge the fact that the problem is out of control. And that's really the second reason why there's been growing protests about our drug policy. And that reason is that the outcomes of our drug policy have been terrible in terms of deaths, disease, crime, corruption, violence, and even threats to national security. I'll explain why I say that in a moment. If we look at deaths, for example, we prohibited in Australia the production and importation of heroin in 1953, in May 1953. Now, it doesn't often happen that the Director General of the Commonwealth Department of Health publicly warns the government of the day that you've made a mistake. But that's what the Director General of the Commonwealth Department of Health did when the government prohibited the production and importation of heroin. Heroin at that time had been lawful to prescribe and was used quite a lot in the management of childbirth and obstetrics, and also in management of advanced cancer. Nevertheless, it was banned in 1953. The president of the College of Physicians publicly complained, and the president of the Royal College of Obstetricians and Gynecologists complained. We weren't adult enough as Australians to have an Australian Medical Association in those days. We still had a British Medical Association. But the president of the British Medical Association complained on our behalf. So there was a lot of unhappiness in the medical leadership in 1953 that a mistake was being made, and indeed it was a mistake. So heroin overdose deaths were very rare at that time. In 1964, the year we've got figures for, there were actually 6 deaths from heroin overdose in the whole of 1964. In the year in which heroin overdose deaths in Australia peaked, 1999, there were 1,116. So we went from 6 to 1,116. During Prohibition, the policy that's meant to protect you and your family and your loved ones. Now, the population also increased during that time, and when we adjust that increase for the increase in the population over that time, the rate, that is the number of deaths per million population or per 100,000 or whatever, increased 55 times between 1964 and 1997. 55 times between 1964 and 1997. So this is a serious problem. deaths, disease, crime, corruption, violence, threats to national security. If we look at disease, we didn't have conditions like hepatitis C or HIV back before Prohibition. These were conditions that were able to spread rapidly in our community because of Prohibition. We were in a situation in 1953, before heroin was prohibited, where property crime and violent crime was very rare. People often, believe it or not, in those days, went out shopping and deliberately left the front door unlocked. No one's going to break into my house and steal. These days, of course, everyone bolts their front door and back door and windows and switches on their expensive electronic burglar alarm, and all our cars have expensive burglar alarms, and we have to have these things because Prohibition has made crime so rampant. Threats to national security. How on earth does this guy say Prohibition increases the threats to our national security? Well, the reason is that Prohibition undermines countries that are vital to our strategic national interest. So it doesn't help us that Pakistan, Afghanistan, Mexico, big problem for the United States, those countries and some others are destabilised by drug prohibition. It's very clear that that was a major factor in Afghanistan. We lost, 40 soldiers and had 10 times that number seriously injured in Afghanistan. And the beginning of of that war period, Afghanistan used to export opium and heroin in small quantities, and 80% of it was as opium and 20% of it was as heroin, which is much more lucrative to sell. By these days, those figures are reversed. It's 80% as heroin, 20% as opium, because they need that money to buy the mortars and the guns and the bullets to fire at our soldiers. So threats to national security is a big issue. I'm not a security expert. Security experts say this. American security agencies say this. So it's a serious issue. The third reason I want to put to you why drug prohibition is really not something we should put up with anymore is because of the basic unfairness of drug prohibition. Now, in Western countries, in developing countries all around the world, we've had several centuries, frankly, of outright homophobia. The heterosexual majority thought it was quite all right to punish people who had minority sexual preferences. So in 1895, Oscar Wilde got 2 years hard labour in prison for having sex with another man. In 1952, a chap called Alan Turing in Britain, who'd been instrumental in unravelling the code that the Nazis, the secret code that the Nazis used to communicate with their military, the Enigma code, Turing was critical to the success of unravelling that code at Bletchley Park. In 1952, he had sex with his boyfriend. They had some argument. The boyfriend went to the police, told the police about Alan Turing, and Alan Turing had to appear in a magistrate's court and was given the choice of going to prison or taking female sex hormones. Couldn't hack the idea of going to prison, so he decided he would take female sex hormones. The other thing about Alan Turing is that Alan Turing, because of the work he did at Bletchley Park, unravelling the Enigma code, he was fundamental to the development of these guys, which have transformed all our lives. And this is Apple equipment, and you all know the logo of Apple equipment with a chunk taken out of it. Alan Turing couldn't handle the fact that he didn't shave anymore. He was impotent, was growing female breasts. So he injected an apple with strychnine, And when they found him, there was a chunk of that apple missing. He'd eaten that chunk of apple and died of strychnine poisoning. And it's rumoured, never proven, that Steve Jobs chose that logo as a mark of respect for Alan Turing. So Alan Turing dies, commits suicide in 1952. 1957, the British establish a commission, Wolfenden Commission, to think about what that meant. And that's where the phrase about having sex with consenting adults in private comes from. That commission, that phrase gets quoted again and again and again. Well, we're now around the world, we're unravelling that wicked, that cruel, that totally inappropriate, in my view, punishment by the majority of people with minority sexual preferences. But we still have, right around the world, the practice where people with majority drug preferences feel it's quite okay to punish people with minority drug preferences. You're not taking the drugs I like to take, therefore I'm going to punish you. That's really what drug prohibition is all about. It's wrong. Now, all around the world, in every country, the rule of law is regarded as very important. Some countries, unfortunately, less so than others. A lot of resources are put into our parliaments. Beautiful buildings, expensive buildings, paying our parliamentarians and all their staff costs a lot of money, and we do it generally quite willingly because we want to have good laws. We want to have laws that punish people who should be punished, don't punish people who shouldn't be punished. And we set up a whole elaborate justice system so that the sentences that are imposed on people are appropriate. Well, how can it be appropriate to punish people who've got a minority drug preference, provided they haven't harmed anybody else? If they've harmed anybody else, of course, it's a different story. But we've got laws that say you can't break into banks. We've got laws that say you can't rob people or burgle their homes. We've got laws that say you can't commit fraud or take money off other people's credit cards. We've got laws that cover all those. We don't need additional laws that say that you can't do that if you've been taking drugs. So if people who take drugs harm other people, of course they should be punished for that like anybody else, but they shouldn't be punished just for taking drugs. And yet we in Australia and every other country in the world just about does that. That's wrong, has to change. Well, things are changing in that respect, in that the arguments that have been made in this area are now starting to really bite. People accept that we're fighting a battle we can never win. Tony Abbott, when he was Prime Minister, didn't get many things right, but he got it right in April 2014 when he said on 3AW, on Neil Mitchell's program, that the war against drugs is a war we can never win, and it's a war that we could lose. He went on to say, but we should keep fighting it anyway, but that's Tony Abbott. Nevertheless, first Prime Minister to say that, first no leader of the opposition had ever said that in Australia. Give him credit where credit's due. And we've had several retired police commissioners and a few even serving police commissioners who have said in the last couple of years, Australia cannot arrest or imprison its way out of its drug problems. Now that's code for saying, listen politicians, fix this is a big problem. And as somebody said just before we started the session tonight, it's great how police commissioners, many of them, never said a word while they were police commissioners, and the day they retire, they say, we should change these stupid drug laws that don't work. Well, they are being changed, and that's the good news around the world. Overnight, we heard that the Gallup poll in the United States returned a poll showing that 64% of Americans support the regulation of recreational cannabis. That's risen from only 12% in 1969, so it's gone up steadily over a long period of time, and it's continuing to rise. 71% of Democrats, 51% of Republicans now support the regulation of recreational cannabis in the United States. 8 states in the United States have voted to change their laws so that they will start regulating recreational cannabis, and those 8 states account for more than 20% of the US population. So that's big news, and next year, California, the 6th biggest economy in the world, is going to start regulating recreational cannabis. Next year, on July the 1st, Canada is going to become the first G7 country to start taxing and regulating cannabis. Uruguay was the first country in the world, as a country, to start taxing and regulating cannabis. The first states to do that were Colorado and Washington, who voted to do that in 2012 and started doing that in 2014. So we're seeing change there. We saw change in New Zealand in 2013. New Zealand, hate to say this as an Aussie, but really the New Zealanders get a lot of things right way before we do in Australia. And in July 2013, the New Zealanders only have one House of Parliament, one chamber, not 2, and their Parliament voted 119 to 1 in favour of the new psychoactive substances bill. And in that bill, people could say that they wanted drug X legalised, and drug X would have to be a drug that hadn't already been prohibited, and they had to give the molecular structure of that drug, and they had to give a fairly considerable sum of money to allow for the government to do tests on that drug to see how dangerous or safe that drug was. So they started that system, and I went to a meeting in Wellington. It was an incredible meeting where they presented the results, and the results had been received very positively in New Zealand. A senior police guy got up with all sorts of ribbons on him and said, "This is really wonderful, and the police are really behind this." The number of outlets had gone from 4,000 down to 40, and the outlets they had were all regulated, and so kids under 18 weren't allowed in them. Good things were happening, and several politicians from different parties spoke, all in favour. It was really a historic meeting, but unfortunately, after 10 months, the scheme was suspended because the system of testing was too expensive, too time-consuming. They want to come back to it, but they haven't figured out how to do that yet. So things are starting to change around the world, and we'll see more change coming in the not too distant future, I'm sure. Let me tell you some things that are happening in our country. Big news here has been the approval by the ACT government of pill testing at a youth music dance event in about a month's time, and then one of the opposition politicians managed to throw a banana skin underneath that, so the Commonwealth withdrew permission for that piece of land to be used by that youth music event. I'm sure the ACT government will sort that out, but the historic thing is that decision's been made. Now, the lack of pill testing doesn't cause a lot of deaths, but it causes enough deaths, and if it's your son or daughter or niece or nephew, surely that's all that matters. If we can prevent a needless death, why don't we do it anyway? So that's definitely a plus. And we're waiting for the Andrews government in Victoria to say what it's going to do about the medically supervised injecting centre that's been proposed in Richmond, a suburb, an inner city suburb in Melbourne, where the chief coroner conducted an inquest into a 34-year-old mother of 3 who died in a toilet in McDonald's in Richmond. And the chief coroner recommended in February, when she handed in her report, that the government establish a medically supervised injecting centre in Richmond, a very popular proposal in that suburb. The residents and the local businesses suffer a lot because of the problems they have without a medically supervised injecting centre. So I think we're all hoping, fingers crossed, that the government will make the right decision. And then I think we need to start questioning why it took so long. The King's Cross Medically Supervised Injecting Centre, approved in 1999, opened in 2001, has been a huge success. There's no doubt about that. There have been about a dozen independent evaluations of the King's Cross Medically Supervised Injecting Centre. Every single report, independent report, has been very favourable. They have struggled to find anything negative to say about that medically supervised injecting centre. So why does it take 16 years from the establishment of the King's Cross Centre to a decision to start Australia's second medically supervised injecting centre? Well, I think we now need to start asking ourselves where the third and the fourth and the fifth and the sixth and how many we need and where should we put them and what should they look like. We really need more of these. We don't need them everywhere. We need them where we've got heroin overdose hotspots, drug overdose hotspots. So that's another positive development. There have been some negative developments, but that's certainly a positive. Sad to say, I agree with everything that Lene has said to you about medicinal cannabis. It was great that we had so much community support, that we had so much support from politicians, Barnaby Joyce, Tony Abbott, from people in the media who you wouldn't expect to support something like this. Alan Jones. Many others supported medicinal cannabis. The Parliament, the Federal Senate and House of Representatives passed a bill, I think, in February 2016, and I think that was the second anniversary of the death of Lucy's boy, or was it the first anniversary? But in any case, it was marked that day. And but that's great. And then a lot of state and territory legislation has also been passed. But now we've got a situation where only 150 people in the whole country have been able to obtain medicinal cannabis lawfully in the last 12 or 18 months. It's ridiculous. Canada, 140,000. Australia, 150. Now, Canada's been doing it a lot longer than us, and they've got a bigger population, but still, at this rate, it'll take 1 million years for Australia to catch up with Canada. It's not a competition, but what should be the case is that we should be able to make these decisions in a way which is fast, which is reasonable, which is sensible, which keeps the quality of the product up, the price down, which provides a wide range of options. Our bureaucracies are happy to provide pharmaceutical varieties of cannabis. They're most unhappy to allow the plant-based products. And there are unsettled arguments by some respectable, reputable scientists that actually the plant products are likely to be better than the pharmaceutical products. That's an argument that hasn't yet been decided, but it's a significant argument. We don't have any provision in our system for compassion. What about if somebody's got a month to live, you think, and they are desperate to try it, and they're 85 years old? Well, what harm, honestly, can it do allowing that person to have medicinal cannabis? And we can argue many other cases where compassion should play a role. Well, compassion plays no role at the moment. It's all strict rules, and in my view, far too strict. People have to jump through far too many hoops. Tough for the families, tough for the patients, and the range of options is too small, and the end result of that is that many people use the black market. Now, that's not a criticism of them, but black markets cannot be regulated. That's why they're black markets. And because they're black markets, you can never have any quality assurance. You can never be as certain as you can in a regulated market that there aren't contaminants present. There may be some products from the unregulated black market that have no contaminants, but there's no assurance that the product you get today is the same product you got last week and that you'll get in a month's time. And you also need products from the market that are consistent and predictable. We can't ever get that from an unregulated market. I think we can look forward to Australia starting to have a debate about regulating recreational cannabis, and this was, I think, made even more likely by the news last week that New Zealand will have a referendum on regulating recreational cannabis, at least by the year 2020, and that was, the Greens made that one of their 10 conditions when they went into government with the New Zealand First and Labor. So that's going to put more pressure on us. Good thing too. We need to have a debate about the heroin trial. You remember the heroin trial that we did research on, world-leading research that we did in Australia for 6 or 7 years, from 1990 till August 1997, when Prime Minister Howard and his cabinet stopped that research. And other countries took up our research, and now there have been trials in 7 countries with over 1,500 patients in those trials. They've all been a huge success. The trials have been successful in people who've got 2 characteristics. One is very severe problems, very severe heroin dependence, and 2, they have tried multiple previous treatments and no treatment has benefited them. So this isn't something for people going to treatment for the first time. This is for something for people who have gone in and out of treatment, nothing's worked for them, and so in desperation you try heroin-assisted treatment. Heroin-assisted treatment means high doses of heroin, means the patient has say over the dose, means every dose is supervised, means they're given intensive psychosocial assistance, and the results are really fabulous. It's not a cure, doesn't work in 100% of cases, nothing does unfortunately, but it's certainly well worth trying, and those 7 countries that have tried it are very happy with it. Denmark became the first country in the world that adopted heroin-assisted treatment without having done a trial on it, because they can't afford, the small country, they can't afford to do trials and everything. This is another argument that we put away in 1997. We should pull it out again and have a look at it. One of the other things we need to talk about, Lene touched on it briefly, is roadside drug testing. And this is a real travesty. This is shocking. Victoria became the first jurisdiction in the world to introduce roadside drug testing in 2004, where they test cannabis, or they test drivers for cannabis, for methamphetamine and for ecstasy. Now there's debate about how seriously to regard those drugs in terms of the increased risk of a road crash, but there are many other drugs we know are a much higher risk of a roadside crash for the driver, which aren't being tested. If we're going to have roadside drug testing, why test for drugs where the risk is much more modest than other drugs where the risk is much higher? So it's based on science that is flawed, and the ethics is flawed. They don't even tell us what it's, when you have the roadside drug testing, it's either positive or negative. They don't tell you what the result is. The laboratories are set for different levels in different states and territories. They say it's about impaired driving, but we've got no proof that there's actually any impairment by the driver. It really is shocking. Every state and territory by 2011 in Australia had started doing roadside drug testing, and it's something, at the very least, we need a parliamentary inquiry. We need the media to take an interest in that. Now, there are many other things I could go on in a similar vein forever, but I'll spare you that. But one thing I do ask you to do is talk about this amongst yourselves, talk about this with your friends, talk about this with your members of parliament, go and see them, go and write letters to them, write letters to your local newspaper, easier to get into the letters column in rural and regional areas and suburban areas than it is in the big metropolitan newspapers. Talkback radio. You've got a lot of opportunities to voice your opinion, and if you think prohibition stinks and we ought to do something else, well, please say so. Now, if we're going to do something else, I'll just finish by saying, what should that something else be? Well, I think the threshold question is whether we regard drugs as primarily a criminal justice issue or a health and social issue. And I think it has to be, we have to flip this around so that we start thinking of drugs primarily as a health and social issue. And what that means is that we think of it like we think of alcohol and tobacco. We don't arrest someone we see smoking a cigarette in the street or in a park or at a beach. We encourage them to go to counselling. We encourage them to give it up. We encourage them, at least I encourage them, to switch to e-cigarettes. I'll say something about that in a minute. But we certainly need to encourage people to shift the focus from a criminal justice framework to a health and social framework. There'll always be a role for the criminal justice system in illicit drugs. If somebody arrives at Brisbane International Airport with a suitcase full of black market Johnny Walker, of course they get into serious trouble. And likewise, if they arrive at Brisbane International Airport with a suitcase full of unsanctioned cannabis, say, they also deserve to get into trouble. So there's always a role for the criminal justice system, but not trying to put the full burden of this policy onto the shoulders of the criminal justice system, because the criminal justice system has shown that it can't deliver the results. And when it tries, it makes a bad situation even worse at very great expense. So that's the first thing we need to do. We need to improve drug treatment. When Portugal changed its policies in 2001, not many people realise this. A huge part of what Portugal did was to improve drug treatment. And we need to make drug treatment just as good as other parts of the health service, just as available, just as high quality. Not better, not worse, same quality. And it is far from that at the moment. If you know somebody who's got a really severe problem with drugs and is trying to get help, you'll know that it's really hard for them to get help, to find where to go and then there's a long queue of people who've been there waiting their turn ahead of them. So we need to improve drug treatment. We need to also put much more emphasis on the social side of this issue. If a 22-year-old kid who's had a pretty horrible start to his life or her life, horrible housing, not a very nice home life, missed out on having a decent education, looks ahead to decades of unemployment, well, chances are pretty high that kid is going to think, well, maybe spending the next 4 hours on a chemical vacation is not such a bad idea. But if that kid's had a good start to his or her life and looks forward to an enjoyable, promising, attractive future, chances are that kid will say, well, why should I waste my time on drugs when I can study or do some work or help mum and dad or do some volunteer community work. So that's the sort of approach we need to take. We need to engage our young people and make sure that our communities work together better, a lot stronger. I want to say something about e-cigarettes, and I'll finish on that because that's really one of the big debates that's now developing here. And e-cigarettes are part of this, justifiably part of this mix. Why? Because cigarettes, tobacco, kills more people, kills more Australians than all other drugs put together. Also, cigarettes cost the Australian economy more than all other drugs put together. They really are a significant problem. Now, Australia's done pretty well over a long period of time, mainly relying on reducing the supply of cigarettes, making it harder for young people to get hold of them, basically, and also reducing the demand for cigarettes. So we've worked out how to get good education out to young people to discourage them from wanting to start smoking. And if they haven't started smoking by the time they're 18 or 19, they're probably never going to smoke, which is good. And we've done well with that approach. We haven't done quite so well with helping people to quit smoking, but that's also part of the bargain. In 2003, a pharmacist in Beijing called Hon Lik, who had been sent to labour camps in the countryside when he was a young man and had learnt to smoke cigarettes, much to his chagrin, and found that he'd become a chain smoker and had tried many times to give it up. He was I heard him talk last year in Warsaw, very interesting man. He had a lot of interests, and he realised that he had to get nicotine into his body without the smoke of cigarettes. That's what he had to do. He had to design a way of getting the nicotine so that he didn't have that craving. So he designed what became the world's first commercially successful e-cigarette. First it was too bulky and too complicated, and he worked on it. By 2003-04, he was ready to take that to the market and get people to start manufacturing and sell it, and it took off like a bomb. And initially a lot of people were very resistant to the idea, but slowly the idea has really caught on first in United Kingdom, and then it's caught on now in New Zealand and Canada, and just this year it's really catching on in the United States. But Australia is dead against e-cigarettes. They're really banned. Do you know that if you have nicotine liquid for e-cigarettes in Western Australia, you can be fined up to $45,000, $45,000 for having nicotine liquid to put into e-cigarettes. That's outrageous, surely. In New South Wales, the fine is $1,000. It's much more than that here in Queensland, the maximum fine. So this is a craziness that is all part of the push for abstinence. Now, abstinence is great for people who want it and are able to achieve it. But a lot of people, at least initially, don't want it or aren't able to get there. And for those smokers who are unable or unwilling to quit, e-cigarettes should be easy to get. It should be easy for them to switch from smoking, a very dangerous way of taking in nicotine, to e-cigarettes, which are much less dangerous. They're not completely benign, but if they're reducing their risk substantially, why should we allow governments to stand in their way? So this is another argument that you're going to hear more and more of. We've been ramping up that argument in 2017. I'm sure you'll hear more about that in 2018. Let's hope one of these days that policy will change. Just last week, the Minister said, Greg Hunt said, it's never going to change while I'm the Minister. Well, maybe not this Minister, but maybe the next Minister or the Minister after him. So there's a lot in this, and I hope you will all think about the ways in which you can actually contribute to change in the way that Lene and her family are contributing to change. And Lene, once again, I thank you and your family for all that your family is doing to help Lindsay, and not only to help Lindsay, to help the many other Australians who really need medicinal cannabis to improve the quality and quantity of their lives. So you've all heard the metaphor about the heavy rock and the steep hill. Well, the battle we've got is a very heavy rock that we're trying to push up a very steep hill. But this year in Australia, for the first time forever, that rock got just a little bit less heavy and the hill got a little bit less steep. So let's keep pushing it and see if we can push that rock to the top of the hill. Thank you very much.